I'll begin. My name is Mark Human. I'm a Shine counselor. And what we're going to talk about today is Medicare open enrollment and the changes that Medicare's making or not making. This presentation is not really to talk about how Medicare works, although I'll cover as much as I can, but what you need to do during open enrollment. And I'm a Shine counselor, not here. There's a very good Shine counselor here, I think, on Tuesday afternoons. There's about 600 Shine counselors in Massachusetts. We're all volunteers. We're all certified, so we have to take exams once a year. We have to go to meetings once a month, and we're supposed to be on top of all the information on Medicare. So SHINE stands for Serving the Health Insurance Needs of Everyone.
Wonderful meeting you folks.
Shine counselor. Okay, so what we're going to do is talk about how you should be reviewing your plan. If you are already on Medicare, you have an opportunity to make changes that will be effective January 1st of 2019. Okay, a lot of people just keep what they have without really thinking about it, so it's really time for you to think about, do you need to make changes? Many things could have changed. Your health could have changed. Your plan could have changed, and it's not offering what it was. You want to change because you're either paying too much or you're paying too little and not getting what you want. So this is the opportunity to do that, and that's what open enrollment is all about. Before I even begin, this is important. Did everyone here that's on Medicare get a new Medicare card?
Yes.
Anyone not get one? Okay, that's good. Because they sent out Medicare cards, I think, during the summer was Massachusetts' time to get it. So you all should have gotten it. If you need that card, when you go back to see your doctor or hospital, give them that new number. I'm just going to be quick about the different parts of Medicare. You probably all know it. Part A is hospital insurance. Anyone that worked 10 years or 40 quarters and paid into Medicare should get Part A for free. Part B is medical insurance, so it's almost everything else. Doctor visits, lab tests, outpatient, etc. The price went up a little bit, went up by $2.50. So the base price is $135 in 2019. If you're on Social Security and taking Social Security, it'll come right out of your Social Security check. You probably know that. And Part B pays for 80% of anything that's medically necessary. Those two things, A and B, they're called original Medicare because that's exactly what was passed in 1965. So it's 52 years old now. It hasn't changed all that much. I'm going to skip over Part C for a minute. Part D is prescription insurance. That was added in 2006. And bundled together, A, B, and D are really what they call Medicare. Part C is really a combination and includes what they call Medicare Advantage plans. These are all private plans that will accept your Medicare. They include, you still have to buy B, but it includes A, B, and in most cases, prescription drug plans. They are all HMOs or PPOs. Are you familiar with that concept? They're either health maintenance organizations or preferred provider organizations. They're private, and they all charge you co-payments for all the services. And I'll talk a little bit more about that.
What about Medigap?
I'll talk about that in a minute. I'm pushing the wrong button. Okay, so important dates. Anyone that's on Medicare, either on a Medicare Advantage, one of those private plans, or on a Part D drug plan, should have gotten what they call an annual notice of change. And it should have been mailed to you before September 30th, or by September 30th. Okay, that document is important. I know it's big and hard to read, but it tells you things like prices are going to change, what you're expected to get may change. In other words, you're getting your co-payment for something was $10, it's now going to be $20. For drugs, it will tell you any changes, both in price, in deductible amounts, and what's on their formulary. So you may be taking a medication that the insurance was paying for, and it's not in their formulary for 2019. So check out those annual notices of change. Sure, that's a good question.
Was that done, was that supposed to come from the federal government?
No,
or
that's-
through your plan?
Your plan.
Through your plan?
Either through your Advantage plan, if you're on an Advantage plan, or through your prescription drug plan.
I'm having difficulty with that because you say September 30th,
Yeah.
and I've been told by the plan that I have, for my drugs at least, that they can't possibly get anything to me until the end of October, beginning of November. That's
The
what I
annual
was
notice
told.
of change?
Um,
They didn't send you one?
No,
They're mandated.
I'm waiting to find out even if my drug is going to be carried by them for next year.
Yeah.
And I can't find this out. And then my insurance for like Blue Cross Blue Shield kind of thing,
Mhm.
all they sent me was notification of it's going up $6 a month starting blah, 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 but nothing
Medigap
else.
plans will not send you an annual notice of change.
They won't.
Okay, they don't need to send you an annual,
Oh,
and I'll
okay.
explain that. It's the Medicare Advantage programs, those HMOs or PPOs that
Well,
need
the
to send you.
PPO is the one I'm having the difficulty.
Oh, it is, okay, so.
Oh, I don't know. I was on the phone with them last
We
night, but I
can
didn't
talk
get
to
any
me,
place.
let's talk about this afterwards.
Okay, thank you. I'm sorry.
No problem. Other dates. By October 15th, open enrollment has begun. So that was last Monday, I think. And you have till December 7th to change your plan. And everything that you make change is effective January 1st. Now, this is something brand new that just started this year. If you are on an Advantage plan, anyone here, people here on an Advantage plan? Okay. You can change your Advantage plan between January 1st and March 31st. Okay. So you can change to a different Advantage plan. You can go back to original Medicare and buy a prescription drug plan and a Medigap. So you have that opportunity to try an Advantage plan now, and if you don't like it between January and March, you can change it again. If you do change it, it's always effective the first day of the following month that you changed it. So if you change it in January, it's effective February 1st.
Yeah, I'm on original Medicare at this moment, but I am looking to get an Advantage plan.
Uh-huh.
If I can do it in this period, right? The open enrollment, get an
Yes.
advantage plan.
Yes,
And that means if I don't like it or something, I will be able to go back to my original Medicare
yes,
on that date from January to March.
yes.
I can do that.
It was brand new.
Okay.
Okay, they used to have something called a Medicare disenrollment period, which went to February 14th, but you couldn't change to a different plan. You could only go back to original Medicare. Now you can actually change to a different Advantage plan if you want.
I'm sorry,
You
can I
can-
go back to my original?
You can go back to original Medicare.
Without any penalty or nothing like that?
No penalty.
No penalty?
No.
Or-
If you are on original Medicare, you cannot go the other way with this. This is just called a Medicare Advantage open enrollment period. So this is new.
This is for like the PPOs?
Yes.
Yes.
Does that also work for GAP?
No.
No.
You can get up, you can be on an Advantage plan and go back to original Medicare with a gap, but you can't go the other way. Okay, so what can you do during open enrollment? You can change your Medicare Advantage plan. You might always want to check, is your doctor still accepting the plan that you're on? If you're on an Advantage plan, that's probably the most important thing about the Advantage plan, are the doctors you go to accepting that plan. You can change your prescription drug plan, and this is one that I advise everyone to look at, because every year those formularies change, the prices change, there are new plans, so you might find something better than what you had.
Where do you go to find other plans?
The one place to find all the information on the plans is a website called Medicare.gov. And also the Shine Counselor can help you do that. Okay, the other things you can do, you can change between an Advantage plan and a Medigap plan. Let's say, let's say you were on an Advantage plan and you need several tests, you're getting sicker, our health needs change, and you want to decide that you should go on to original Medicare with a Medigap plan because that pays more. Or you can change which Medigap plan you're on. You might not be happy with, I'm going to just make the Up Blue Cross and change to TOPS. There are 6 or 7 companies that offer those Medigap plans. And you can drop your Advantage plan and go back onto a supplement. So as I said, you should have gotten that annual notice of change by the end of September to look at it. I know it usually is a pretty thick manual, and a lot of people like put it aside.
Oh, yeah,
Because-
they do send you that, but they don't send you everything you need. There's
Well-
always something missing, and that's what my situation is. Because I heard my medication, one medication took a big jump upward, but I haven't been able to find out if they are even going to carry it.
Okay. Talk about that.
Okay.
So look at those annual notices of change, because medications change, prices change, deductibles change, a lot of things change. And it also helps to know, does that plan still meet your needs? It's, as our health changes, our needs change. By last week, you should have also received from each of those plans an evidence of coverage. Actually, this year they allowed you to get a letter saying that your evidence of coverage is available online and give you the option of saying, no, I want a hard copy. So all they did was send you, many plans would have sent you a letter saying the evidence of coverage is now online and give you a website that you can go to. If you want a hard copy of it, there's a way to get that hard copy. I said all that. Also, you should have all gotten Medicare and You, the manual. That's pretty helpful. It gives you some information. Not as much as the Shine Counselor knows. So I'm going to start with the supplement plans first. People here are on supplement plans, Medigap plans. Everything in Medicare has at least two names, Medigap and supplement. To confuse you. Okay? Those work with A and B. There are no networks. They are, there's, as I said, 6 or 7 companies that provide this. Massachusetts law, they all have to provide you the same medical coverage. They all have different prices, but they all have to give you the same medical coverage. Essentially what they'll do is pay some or all of that 20%. Remember, Part B pays 80%. You need something that will help you pay that 20%. And that's what a Medigap is. They also help pay the hospital deductible. Some. There's no networks. You can go to any doctor, any hospital, anywhere in the United States, as long as that organization accepts Medicare. In this area, I would say 99.9% of the doctors accept Medicare. And Massachusetts has, very lucky, we only have 2 different Medigap plans. One is called Supplement Core and one is called Supplement 1. You go to another state, they have 10. We don't need 10, we only need 2. And the blue sheet here in the package tells you about Core and Supplement 1. In the package I left on the table? Okay. I'm not going to go through it all, but essentially, if you had Supplement 1, everything medically, which does not include prescriptions, is paid for. Okay, you go to the hospital, you have no payments. You go to the doctor, there's no co-payments. You go for lab tests, there's no payments. As long as it's medically necessary and Medicare pays for it, Supplement 1 will cover your expenses. Core is similar to that, except it has a hospital deductible of $1,364. Okay, so $1,364 if you were to be inpatient in the hospital. That's your copay if you are on Core. And the other big difference is that there's a $185 deductible each year. So it's basically the first time you go to the doctor, there's $185 out of your pocket. On the back side of it are all the companies that offer this. And the price of this is the premium for Supplement 1 and the premium for Core. Massachusetts is very unique from other states. You can join supplement program every year. In fact, you could join a supplement program every month. Okay? It's continuous open enrollment into these plans. So they don't, these plans don't include prescription drugs, so be careful of that. But if you want to change plans, if you want to change between core and supplement one, you can do that in Massachusetts. So my example always is, you have core, and there's that 1364 deductible for the hospital, and you go out and truck hits you, well, you're out of luck, you're going to wind up in the hospital, and you're going to have to pay that $1,300. However, you could also say, see a doctor, and the doctor says, you need shoulder surgery, and we'll schedule it for next December, and you're on core, you can switch to supplement one. And when you're all better, you can switch back to core. It's a Massachusetts only. The one thing I need to warn people about on this is disenrollment from this is not automatic. Disenrollment for almost everything else in Medicare, like if you were on an Advantage plan or if you were on a prescription drug plan, Medicare knows about that. Medicare does not know about your supplement. So if you decide you don't want the supplement anymore, it's up to you to notify the company, if it's Blue Cross, Tufts, Harvard Pilgrim, that you no longer want it. And I would do that in writing. And of course, they don't provide Part D drug plans. So in addition to buying the supplement, you also have to buy a Part D drug plan. Questions about supplements? So what can change on that? The monthly premium can change, and you'll see the change. If you're on a plan now, you'll see change. I think I just looked at Blue Cross this morning, it went up by $3 or something. So, and people, you might be on core and, things are changing and you're feeling more fragile and you're feeling like I might be hospitalized. So this is a good time to look at it and think about it and say, I'm going to change to supplement one. And also, of course, you're very happy with it. They're giving you a hard time, So if you're on Humana and they gave you a hard time, maybe you want to switch to Blue Cross. So these are, I listed some of the ideas, what to consider before you change your plan. Yes, ma'am?
On the back where you show the Medigap carriers.
Yeah. And these are all things to consider. That's all. Okay, now I come to the hardest part about Medicare, which is the prescription drug plan. So Part D is prescription drug plans. Even if you are in an Advantage plan, and that Advantage plan has drug coverage, everything I say about Part D applies to the drug portion of the Advantage plan. Okay, so put together a little anatomy of a drug plan. There are obviously monthly premiums. If you are on an Advantage plan, that premium is built in to your costs, and I can tell everyone how much is for medical and how much is for drug, if you want to know. Many of the plans have a deductible, not all of them, but many of them do. They go high as $420. Many of the plans don't charge you the deductible for generic drugs. So there's a piece of paper, a salmon, that you probably need a magnifying glass to read, but it lists all the drug plans in Massachusetts. And I think we asterisk those that don't charge for generic drugs. They don't charge the deductible for generic drugs. Okay, so every one of these plans puts drugs in a tier. Most of them have 5 tiers. Tier 1 and 2 are generic drugs. Tier 3 and 4 are
You're not generic.
right, they're not generic drugs. Tier 5 are specialty drugs. They're all of them have co-pays associated with them. So when you go to the drugstore to pick it up, you pay the co-pay, depending on what tier it is. There are currently no regulations on these companies. So you might say it's a generic drug, and they will tell you, no, it's not a generic drug, and put it in a tier. So be careful of that. They are allowed to do that. There's a few other cost components there that you need to be aware of. The pharmacies, most of them have a pharmacy that they consider a pharmacy that will offer you a better price. So sometimes, I always use CVS and Walgreens as an example, but sometimes your drug may be cheaper in one than in the other. And I don't mean by a few pennies, I mean by a lot of money. I think this chart tells you each of the plans, it does, each of their preferred pharmacies. Okay. Other things to consider is they all have their own formulary. Formulary is a list of medications that they'll offer. They are not all the same. So you want to make sure that the medication you're on is in the plan's formulary. And that's probably really important, because otherwise you'll pay full price. They have restrictions that they put on some of these drugs. So those restrictions could be quantity limits, that they only allow a certain quantity. It could be that they need prior authorization. They will not give you the drug unless your doctor has filled out the prior authorization form. And there's also this thing called step therapy, where they'll start you on a cheaper drug for the same thing and make you go through that. Yes, sir.
I found out the hard way that pre-authorization means they can deny you.
Yes, they can do that.
So just because you call them up and say, is this covered? And they say, oh yeah, just get pre-authorized. You go and they say, yeah, well,
Right.
we're denying you.
Right, that has to become between you and your doctor, and there are ways to appeal that.
There are, and they can deny you.
I discovered a few years back that one medication I was taking, if I did it through the drug insurance program that I had, it would have been a lot more expensive. I went to the drugstore and said, if I pay for this outright, how much will it cost me? And I was flabbergasted by what they said. So I said, okay, that's fine. I'll have my doctor send the prescription to you, and I just go in now and pick it up and pay for it outright. So that's part of another thing that's going on with these drug companies, insurance companies.
Yeah,
You have to check the pricing carefully.
right.
It differs also from pharmacy to pharmacy.
Yes. Pharmacists are not supposed to do that. I would advise you all to become friends with your pharmacists, because they will do it.
Really? They're not
Really.
supposed to do that? How about that? That's interesting
Because,
too.
you know, you go to CVS, they're a big middle person for the drug companies.
And then Medicare does pay for certain things that you might need. Not necessarily a drug, but like apparatuses or whatever,
Right,
testing.
right. No,
things,
this is just
strictly pharmaceutical.
pharmaceuticals that you buy at the drugstore.
Hmm.
And then, as I said, check the preferred pharmacy that's on the list. Those change a lot. I think, last year, Walgreens seemed to be the one that most of them have. This year, it's CVS. So,
Well, Walgreens combined with Rite Aid,
Aid,
they
yeah.
joined together, and then
Right.
there was major changes in pricing after that.
okay, so the costs for the drugs and the coverage change. So right now, they're supposed to be, if we looked on Medicare.gov, which gives you the opportunity to put in your medication, see how much it costs. It's frozen between now and January 1st. Doesn't mean that on January 2nd, they can't change the price or can't take it off their formulary. So be careful. Now, most of them, if they do take it off the formulary, will allow, with some effort, will allow you to continue that drug.
You know, it's ridiculous, the amount of money that the United States charges for drugs.
They do?
I was in Florida and ran out of a medication. I went to CVS, which was my pharmacy, and I said, could you just give me 2 pills? He said, I would have to charge you $100, $50 a pill. The pharmacist was a gentleman over here temporarily from England. He said, in England, I would not have charged you a penny.
That's right.
No.
Don't let you ripped off
Thank
big
you,
time by the
politicians.
pharmacist for
You need
that.
to call your legislatures and have them do something about
Well, but the drug
it.
companies won't do anything.
It's not changing.
Except,
What I heard lately, what's going to change is the advertisements on TV are going to tell you the full price.
Which is great.
Well, that has a good effect and a bad effect, because maybe that's the right drug for you and the price scares you away. So I'm not sure.
Do all of these drug companies have what they call the donut hole?
Yes.
Do they all get into that? Okay.
Yeah, I'll talk about that in a minute. Think?
Excuse me, on the Medicare Advantage, so they have their own formulary,
Mm-hmm.
and so if the drug isn't there,
You're
that's
paying
it.
for it out
Yeah.
of your pocket.
Oh,
So that's, yeah. The-
So they
the
don't
thing-
have a Part D, it's just in there.
Well, everything I say about a Part D applies to the Medicare Advantage.
Also, okay.
How, is it easy to join Medicare Advantage? I mean, do this?
Yeah.
Oh, okay.
So here's some things to consider if you're going to change your drug plan. How much do you spend on prescription drugs? Do you hit the donut hole that this lady just brought up? The donut hole was scheduled to go away in 2020, the Affordable Care Act. It is almost away, so whether they continue taking it away or not is up to Congress. But what happens is, I won't explain the donut hole. I can tell you a whole thing about it. But
I don't know anything about what is the downfall?
okay, once the cost of the drug reaches a certain amount, you are going to pay more for that drug. Okay? And then when it reaches yet another amount, you're going to pay less for that drug. Is that the best way to explain it? It used to be that once you paid a certain amount, once the cost of the drugs reached a certain amount, that you would have to pay the full amount of the drug. So the Affordable Care Act took that away, but it took it away over a 10-year period. This would be the last year of it.
That's about to change again.
Yes,
Yeah.
probably.
We don't know which way it's gonna go.
Right. So other things to look at is the deductible too high. Look at that sheet, the salmon colored sheet shows you all the plans that have a deductible. And for help with the prescription drug, whether you want to change it or not. I think Medicare.gov is an excellent way to do it if you know how to use it. If not, perfect use of your Shine Council. Now, there's always more, right? You have to make sure the medication, your medications are covered by that company. So the hardest thing, and this is really where our Shine Counselor can help, is you've got several drugs that you're taking, and none of the companies cover all of them. So you've got to play games of like, all right, what's the cheapest plan that I can take that will cover my most expensive drugs, and I'll pay for the less expensive ones over the counter.
Yeah.
Also, since we listed the pharmacies that each of these companies are tied with, is it convenient for you? Most of these companies also offer a mail order. The mail order is not always less money than going to the pharmacy. So check that out as well. Sometimes it is, but not always. And then you need national coverage, meaning you spend the summer in Florida, the winter in Florida, and can you go to the drugstore in Florida? So sure, there's national coverage.
Just last year, I didn't pay attention to the open enrollment period, and I let it roll. I actually didn't pick a Plan D plan, and I was rolling one of the bottom of those plans, and I don't take any prescription, zero.
Yep.
And I have been paying a big
Okay.
dollars for.
Okay, even if you don't take any prescriptions, you should enroll in a drug plan unless you have drug coverage somewhere else. So if you're a veteran, you can go to the VA and get your medications. But or you have a cousin that has you on their plan and you can get the drugs from that, that's fine. Otherwise, even if you don't take any, then at least pick the least expensive plan.
That's what I.
If you're not on, this is similar to Part B, if you're not on Part D and you later on join a Part D, you will get penalized for the time that you weren't on Part D.
This happened to me in 2006. I wasn't on any medication. I was busy taking care of a person who was on medication, blah, blah, blah. They made the new law that you had to have insurance. I didn't know anything about it. And then later, 2 or 3 years later, I discovered that I was going to be penalized every single month and for the rest of my life.
That's right.
So I pay not only, what you normally would pay to the insurance company, plus I pay this penalty to the federal government. And I've been trying to figure out a way to see if there's some way that I can get them to do away with it, because it's crazy.
In the back of the presentation, I have a phone number for Medicare Rights.
Okay, good.
You could call them. So now I'm going to talk about the Advantage plans. People on the Advantage plans? Yes? No? Okay. They are all private. Okay? So essentially, you still have to buy Part B and you still have to get Part A, but essentially the government sends the private company some portion of that money and says, take care of it. Okay? They all have to provide all the services that Medicare says they need to provide. However, they can charge a copay for any one of those services. They all have their own network, so an HMO is particularly restrictive. If you join an HMO, you have to only go to doctors in that plan's network. PPO is a little less restrictive. It allows you to go out, but be careful of that. Depending on the company, they have their own rules on when you can go out. So I would not just take it, you can go out of network, check with the company. Yes.
The network is more restricted. I had shoulder surgery, I wanted to go back to the same doctor that did me the leg. With Tufts, I can see, if I have kept my primary care doctor, which is up in Concord, I can see certain doctors. Now, the shoulder doctor takes Tufts,
Yeah.
but he's in Framingham.
Uh-huh.
I can't go there. They will not cover it for me to go there,
Right.
even though he is.
It depends on the plan. Each one of these plans on their website will tell you who their providers are. So what hospitals you can go to, what doctors you can go to. I found that in Medicare Advantage plans that are not as restrictive as you just made. So I think for Tufts, they open up their entire network.
That was through Medicare.
Was it?
Yeah.
Okay, then I'm wrong. Most of these companies will also provide extra things. And I went to a presentation from all of the companies. I had them come in, and all they talked about was their extras. So they'll offer you vision, they'll offer you dental, they'll hearing, gym membership. Some of them provide, give you an allowance for over-the-counter drugs each month. So you can go and buy toothpaste and whatever else you need over the counter, and they'll give you $25 a month. I stopped listening to them because that's all they talked about. And I'm not saying that those things are bad. They're great. Medicare doesn't offer, dental, vision, hearing. But really what you need to focus on is the medical piece. So be careful of being seduced by all these extras, and then all of a sudden you find yourself sick and your co-payments for other things are outrageous. So I'm not saying that what they're offering is bad, but I wouldn't concentrate on that. It's a nice extra. All of these plans have a maximum out-of-pocket amount. So once you've spent that amount, it's free for the rest of the year. Okay, they're pretty high. The orange sheet, is this orange? I don't know. Lists all of the Advantage plans in Middlesex County.
6,000.
Okay? There's 26 of them, 25 of them.
Out of pocket, does that include the monthly premium?
No, out of pocket does not include the monthly premium or any co-payments for prescription drugs. No, it's what we've got. So,
Exactly. Yeah. Move to
I would buy medication from
Exactly.
Walgreens, Rite Aid, and I said, this is really jumped. What's caused this? Is it my insurance company? No, the drug has jumped in price. If you have a problem, go to an Advantage plan instead. That will help you, she said. Well, if you add up all the numbers, it isn't that much of a help.
Oh, aren't you sweet? Thank you.
So what we tried to do on one sheet of paper, both sides, is list all the plans and their premiums and some of the co-pays that you would be responsible for. In 2019, just like in the last 2 years, all of the Tufts plans that are offered by Tufts are considered 5-star plans. Okay? If they're considered a 5-star plan, and that's by the federal government, you can change into that plan one extra time during the year. So outside of open enrollment. So that means if you're in a Blue Cross plan and you want to change into a Tufts plan, you're allowed to do that. If you're in a Tufts plan and you want to change to another Tufts plan, you're allowed to do that. So that's a plus about Tufts.
Did you say that was just Tufts, or
Just-
all of them, just Tufts?
Just Tufts.
Is the
There's also-
5-tier?
Hmm?
That's the only 5-tier of all of these?
Yes, of all of these plans, it's all of the Tufts plans are 5-star.
Okay.
I should say, on going back to Part D, the 2 Blue Cross plans are also 5-star. Yeah. So on that Part D sheet, the 2 plans offered by Blue Cross, you can switch into them during the year, one time during the year.
What are the GIC?
GIC is totally separate from this, okay? So I can talk about that with you by yourself. But if you're in a GIC plan, or any employer plan, that it's usually different than what's offered. Now, GIC, I know, is totally different than anything I'm offering here.
The number of stars a plan gets, since they all have to cover the same thing. Why is one 2 stars and one 4 stars?
Oh, it has to do with customer service, how quickly they respond to the Center for Medicare and Medicaid. There's a list of criteria.
Send in a claim, how long it takes to get your
Right,
money
how many
back.
complaints they've gotten, etc. So I think on Medicare.gov you can actually see, the different criteria, and within each of those criteria is how many stars they got, and then there's accumulation star. Most of these plans also have, just so you know, a 0 premium plan, okay? Sometimes you get what you pay for, but sometimes you can't afford anything else, and at least you have some coverage. Another thing about these Advantage plans that I should tell you is they can offer you more, other than the dental, they can offer you more medical than Medicaid, than Medicare. Okay? So, for example, Medicare doesn't pay for a annual visit to your doctor. Okay? They pay for what they call a wellness exam, which is just talking to your doctor, doesn't pay for the yearly checkup. These Advantage plans probably will pay for it. I don't think anybody really gets caught by the Medicare not paying for that, because you don't just go in for a checkup, you go in and say, my shoulder hurts, and now it's coded differently. Is that clear?
No,
Okay.
I'm lost.
Medicare,
If you go, no, go ahead.
yeah. The biggest thing I think I should warn you about that Advantage plans are good is Medicare has a very archaic rule that in order to go to a rehab after you've been in the hospital, you have to be in the hospital 3 nights. And that made a lot of sense in 1965 when they did it, because they kept you for 3 nights, probably. Now, hospitals want you out as fast as you can go in. Okay? The Advantage plans don't have that 3-night restriction. But of course, you can only go to rehabs in their plan. So, it's a trade-off. I also should probably warn you at this point, although I think it's getting better with hospitals around here, is you might go to the hospital, they might put you in a room, and you think you've been admitted, but you haven't. You always, when you're in the hospital, even if you're in a coma, ask, am I being admitted? Because if they can keep you there for observation. I've seen cases where they keep you there for observation for a week. You're not admitted into the hospital when you're under observation. Even though you're in a hospital room and the nurses come in and it looks like the same to you. So always ask, am I being admitted? Because if you're not being admitted, Part B pays for it. If you are being admitted, Part A pays for it.
I just have a question about
Yeah.
if you're going to a doctor for your annual, you go once a year, let's say for a checkup.
Mhm.
And so now you're saying that they give you a wellness exam?
Medicare gives you, well, when you join Medicare, you can get a full examination. It's
Okay.
called Welcome to Medicare.
Okay,
After that, they do not pay for annual physicals.
so it's just that first time that you
The
go,
first time that
They
you
pay.
go, they pay.
but if you go the next year after that, they don't pay?
They only pay for what is called a wellness exam.
Well, they do
And that's
that
only
every
ask
year.
your doctor saying, how do you feel? That's the extent of the wellness exam. It doesn't, if he does any examinations, that's not included. However, all of the doctors know this,
Okay,
and they probably code it and say, well, she came in with a complaint about her shoulder,
I see.
okay?
So that you're not paying for it?
You're not paying for it,
Okay, thank you.
okay?
Got it, yeah.
But you have a pre-existing condition too.
I can't emphasize enough about this extras that they're offering. And they sound great, but be careful of them. Okay, things that can change on an Advantage plan. The premium can change, and you can see that if you're in an Advantage plan.
Not once you're in it.
Not once you're in it for that year, but they change every year. Most of them have gone down a little bit. And the co-insurance or the co-payments, they can change. We tried to list on this one-pager the most important ones, but obviously there's many more that can't fit on one page. Be careful of things like those tests like MRIs or CAT scans. They can cost you a lot. You can co-pay. There's a column there for Part B drugs. Those are drugs that you would get through infusion, usually in a doctor's office. Most of them charge money. The Tufts plan, actually, some of the Tufts plans are the only ones that don't charge for Part B. So I hope that that doesn't happen, but I see a lot of people that have been diagnosed with cancer and they need chemotherapy. That's what a Part B drug come in. And paying 20% for that is a lot of money. I talked about this new Medicare Advantage open enrollment, just so you can understand this again. That means if you're in an Advantage plan, you can leave that Advantage plan between January and March and join another Advantage plan or go back to original Medicare and get a Medigap and a Part D plan. That's new. Okay, so a lot of people ask what's the difference. The biggest difference is they say that Medicare with a supplement costs more money. I can tell you right now, that's only true if you're healthy. If you're not healthy, those Advantage plans can add up with the co-pays to a lot more money than the supplement plan. With the supplement plan, you can go to any doctor, any hospital, anywhere in the United States. With the HMOs, you're at least restricted to their network. The PPOs may have some restrictions. Medicare, you don't need a referral. You can go to any doctor. Of course, with an HMO, you need a referral. Even if it's to a doctor out of their network, I believe you still need a referral. I talked about the advantage of the Advantage plans is they offer all these extras. And this is covered anywhere in the United States. The HMOs are definitely not covered outside the area. They're all covered for emergencies. So if you're somewhere and you fell and you broke your arm, you're covered. But outside of emergencies, they're usually not covered. So I mean, if people want to go to Florida for the winter, probably this side is better for you. Because your doctors wouldn't be covered there. So, do you want me to go through this again, or people understand the A and B with the supplement and the Part D, and what you get in the Part C?
The being able to join Tufts at any time. If you're in a gap plan, can you switch and join Tufts at any time?
Yes. That's correct. Okay, so this part is about help that you might need in paying for this. There's a federal program called Low Income Subsidy or Extra Help. They will pay for a lot of money for your prescription drugs, but they have a income maximum and an asset maximum. So unless you meet those, you can't join this. But
I'm sorry, I don't mean to interrupt you, go ahead.
okay. It's a great program. I mean, you pay like no more than $3 for a generic drug and $8 for a brand name drug.
What are the financial limits for that, do you know?
I do, but I don't have it off the top of my head.
Okay.
Okay, that's a federal program. There is a state program called Prescription Advantage. It is much easier to get into Prescription Advantage. They also have an income limit. They do not care about assets. They only care about your income. It will help you if the cost of your drugs are high enough that you've reached the donut hole. Okay? Another advantage of joining this, if you're eligible, you can switch plans. It gives you one more, what they call one more special enrollment period. So you can, you've now used a special enrollment period by going into the Tufts, and you've used a special enrollment by that January through March. Well, this one will give you one more. And anyone that's eligible for this, I would advise you to get it, because you never know. This is like worth its weight in gold, especially if it's
And
free.
that's just in this state?
It's just in this state.
Okay.
How do you
The
join?
reason it's worth it, I mean, you might have your plan and you're going along quite well with it, and all of a sudden you get sick and the doctor says you need to take this and this drug and this drug, and
Just say no to it.
your plan's not covering that. If you're a member of Prescription Advantage, you can change your plan in the middle of the year, one time.
How do you
There-
join?
I think I have the phone number in back
Oh, I
of
see.
this.
Thank you.
There's an income limit, and then they also have a limit that if you're over that but still under a certain amount, they'll charge you $200 a year to join that. That's not worth it. Okay, don't get caught in paying the $200 unless when you are sick that you need it, then it might be worth paying the $200. Does that make sense? Okay. There are Medicare savings plans. Those are offered by Mass Health. They can pay for your Part B premium, and some of them, there's different plans. They can pay for your co-payments and et cetera. So those are all income and asset driven. And also through Mass Health, there's something called the Health Safety Net, that if you didn't have coverage and you had to go to the hospital, it would pay. It also would pay for doctors, but only at certain clinics that they publish. So this is the slide on prescription advantage that I just talked about. But the number for that is in the presentation in the back. They also have an online, you can apply online, they take the applications over the telephone, and if you need an actual hard copy of the application, the Shine Council would have them.
Also, some of the companies that manufacture your drugs, you can approach them too.
Yes.
And they will also do something for you based on what you're about, who you are.
Correct.
A lot of them, you don't qualify if you're on Medicare. I was on a very expensive drug, rheumatoid arthritis, but once you're on Medicare,
They won't
the
do
drug
it.
companies,
One of the phone numbers that I put in the back of the presentation, which is on the next slide actually, is for, I will never get the initials right, MC8P or something. It's the Mass College of Pharmacy. They are there,
Yes.
they have a hotline. They are there to
Yes.
help you. They are fantastic.
Mhm.
I can't speak more highly about them.
They're in
than
Worcester,
to
aren't
help.
they?
They will tell you about any of the pharmaceutical programs, if you're eligible. They will tell you other discount places to find your drug. They will tell you about drugs that are similar and have you go back to your doctor and say, what about this? So they're great. So there are other programs. Somebody asked about, you asked about, I think it was you, the penalty. Call the Mass Medicare Advocacy.
Oh, so the penalty?
Mostly they deal with the Part B penalty, which is much more severe than the Part D penalty, but they will.
Is that in your folder here?
Yeah.
Okay.
So, any other questions of talking about? Yes.
I just have a question on the Medigap plans here, the MedX Choice, which
Yeah.
looks like it's the core and the supplement one for $146.23. How does that,
I think you need to call Blue Cross on that.
okay, but,
Because they've never explained it to me correctly.
oh, how wonderful. I just-
The rep that I deal with at Blue Cross doesn't advise it, so,
Doesn't advise it.
correct.
Doesn't advise it.
very helpful.
Oh, my goodness, okay.
It's sort of a hybrid between
Right.
the two, and it doesn't make any sense to me. So that's why I'm telling you to let Blue Cross try to explain.
I'm trying to explain. But they said to you that it's not a good thing? I mean, have they said that? Did they, anything to you about it? I mean, it makes it look like it's great.
The rep that I call all the time has said she doesn't advise it.
Doesn't advise it.
But I don't, I'm sure if you call Blue Cross, they have salespeople that.
That will advise it.
Right.
Right. How lovely, I'm telling you.
I don't understand
This
why,
one here, the top.
I don't understand why anybody would take it.
Because it looks like it's giving you both for $146.23.
It's not, though.
Which one is she talking about?
The
At the very
last
bottom.
one is-
On the blue paper.
And the blue paper, I'm
Yeah.
sorry,
Choice, okay.
yeah.
Yeah, it only, it covers some of each.
Right,
not
it sounds
necessarily-
wonderful.
Not necessarily all of each, but some of each.
Oh.
Yeah,
okay.
let Blue
I
Cross
see.
explain it to you, because I really can't.
It's right here, the blue on the bottom, on the front of. I'm gonna move to England.
There's a lot of deniers over there. There is.
I bet, no
And
matter
we
where
did,
you
you know, we
go.
got a promise
Yeah,
to have the, something change with the Part D plans, but nothing is going to change.
Can I ask about Medicare Part F?
okay.
They're doing away with that one? I read that in AARP. It's one that has an initial high deductible, like 2,500.
Yeah, we don't have, because we only have core and supplement one. We don't-
Oh, okay.
We
Oh,
don't use that
alright.
alphabet.
Okay.
And I just found that one out.
Because
Because I was like, sign me up for F, but we don't have F in Massachusetts,
They're
yeah.
doing it.
Where are
We
you
don't have it in
located?
Massachusetts.
Me? I'm mostly in different,
You only go in and talk about the plans?
no, I'm at Leahy Hospital and at Winchester Hospital and Burlington and Arlington.
Wow.
So I'm not in Stowe, although I've been monitoring this,
Yeah.
or not monitoring, I've been helping the Stowe Council here. So. There's also in the back of your package evaluation, so please fill that in if you can. And any other questions?